just prior to President Obama speaking and reacting, which we heard moments ago, we had started to fold into our a conversation a healthcare attorney out of Tampa, Florida, and he is still holding with us. Jonathan Fleece, you've also written a book with a co-author here in Chicago, The New Health Age. Sir, when we were listening to the president speak, one of the things he outlined in terms of the benefits of healthcare reform now moving forward is some sort of a rebate a lot of us can expect from our insurance companies. Can you expand on that?
Yes, I certainly can. Part of the Affordable Care Act requires that health insurance companies allocate either 80 or 85% of the premiums that they take in, depending upon the size of the company, to health benefits. So there are caps now regarding how much administrative costs insurance companies can incur, including salaries, bonuses to executives, etc. So under those cap rules, if they won't go over the 15% or the 10% cap, that excess has got to be given back to the policyholders.
So depending upon which insurance company you're with, you may be getting some money back?
That's right. If they went over the caps established by the Affordable Care Act for administrative overhead, that may be the case.
Okay, well, a little extra money in the wallet is always an incentive to many. Of course, some insurers might not be happy about that, might say they have costs on the other end that aren't being looked at, but I guess that debate might continue. But let me get your opinion. You're a healthcare attorney. Were you in favor of healthcare reform or not? Partially? A little, you know, where do you stand?
Sure. When David Houle and I co-authored the book, The New Health Age, The Future of Healthcare in America, David's an international futurist. I'm a national healthcare attorney and advisor. We traveled America and really talked to the healthcare leaders and players of all kinds. And what became abundantly clear to us is that the conversation around this issue has been based on nothing but fear, misinformation, and politics. And when you look at the real issue facing America, our physical health and our economic health is not in a state where it needs to be, and we have to move towards a new health age, a transformation. So to say, am I for Affordable Care Act, Obamacare, or against it, you know, there are parts I like, there are parts I don't, but I am absolutely for moving into the new health age as we've outlined in our book, because we can't continue where we are today.
And I guess if I'm following you correctly, and I'm supposing a lot of things here, so you're going to have to fill me in because I haven't read your book, and you might interest me in buying it if I hear a little bit more. And sure. I know it's been a bestseller. So when you talk about the health of America and the economy, are you referring to the fact that there are so many health ills in America, from obesity on, you know, the diets of children, early onset diabetes and so forth, all of these things adding to the cost of health care, things that are potentially preventable, and yet there's so much wrong there, and so costs are rising, and that also ends up injuring the economy. Speaking of money in that direction, is that where you're heading with this?
Absolutely. When you look at the state of health of Americans, nearly two-thirds are overweight. Nearly 1.5 million Americans die a year. That's almost the entire population of the city of Philadelphia, from preventable diseases. Mm-hmm. And when you look at all of those poor health factors, combined with the fact that we have a healthcare system that predominantly in the 20th century pays hospitals to treat sickness, pays doctors to treat sickness, as opposed to paying doctors and hospitals on wellness and prevention. You add all those negative flows together, and you know, that's what's caused the mess that we're in. And that's what's being re-engineered in the new health age, are moving towards new dynamic flows, wellness, prevention, being proactive, giving people incentives and disincentives for living healthier or non-healthy lifestyles. That is the only way we're going to bring down costs in America. And America is ready and willing and open for this, according to all the research that we've got in our book, to really move into a new age.
Well, of course, it's not just a matter of policy and law change. It's also personal habit change that's required, but some of that is also educational. So there's a lot of work that needs to be done, but I suppose it's one step. We've got Meg.